I'd like to thank you all for joining us this afternoon. Most Americans seek non-emergency services at a local pharmacy. Community pharmacies are important conduits between patients and physicians. Statistics show that patients visit pharmacies 1 to 2 times more often than a physician. Why? Because they're trusted and often accessible. Sadly, though, accessibility to community pharmacists has become a crisis in Pennsylvania. Since 2020, Pennsylvania communities have watched helplessly as over 1,100 pharmacies have closed, leaving millions of residents living in a pharmacy desert. The desert does not discriminate in Pennsylvania. Pharmacists are closing down their pharmacies in our cities, suburbs, and rural locations. The desert expanded just a few weeks ago with yet another community pharmacy closing in Somerset County. When a community loses its pharmacy, it loses easy access to medications, vaccines, and trusted care.
We must stop PBMs from expanding in Pennsylvania's pharmacy's desert crisis. Too many pharmacists are being forced to close their doors to their neighbors because PBMs are pocketing hundreds of millions of dollars in Medicaid dollars that should be going to pharmacy care that countless Pennsylvania's seniors and families so desperately need. PBMs were supposed to safeguard Pennsylvania's pharmacy system. Instead, they've raided it, stuffed their own pockets with cash, and now they're trying to create a system that only benefits pharmacies they own. It's a system that operates in secret because PBMs have no transparency requirements when it comes to handling millions of Pennsylvania's Medicaid dollars. Let us get to work, contact your legislators, ask your friends and family to do the same. We must get House Bill 2270 to Governor Shapiro's desk and get it there immediately. The lives of Pennsylvania seniors and families rely on it.
Now, I'm not telling you anything you don't already know, and I've said this before. All across Pennsylvania, local pharmacists are often the only in-person resource for critical health care services. You're a literal lifeline to your communities, and you're vital to your patients and their health, and PBMs continue to squeeze you. To be clear, we've made some significant progress recently behind the leadership of Representative Benham. We passed Act 77, the Pharmacy Benefit Administrator Act, which put in place much-needed reforms and established long overdue regulatory oversight of PBMs. We sent the message loud and clear. The free ride is over, and Pennsylvania is serious about holding PBMs accountable. It's very simple. No more patchwork networks, more consistency, more transparency, and most importantly, protecting patient access and lowering costs.
And we've all seen firsthand this problem here in Pennsylvania. We've seen it in talking with patients, we've seen it with talking with pharmacists, and we believe that House Bill 2270 is the path forward to create a system where our small, local, and family-owned pharmacies still exist. We have suffered a heartbreaking wave of pharmacy closures in recent years. And like the statistics have borne out, over 1,100 licensed pharmacies have been lost from 2020 to November 2025. These closures are not just numbers. These are individuals, these are pharmacies, these are pharmacist jobs and access in our local communities. It's seniors, it's people without vehicles who can't drive to a pharmacy, those managing those chronic conditions. And without a nearby pharmacy, how can they survive?
No taxpayer in Pennsylvania should have to worry about access to their medicine or their pharmacy needs. No taxpayer at all in Pennsylvania should worry about that. I'm hopeful that our governor and the General Assembly understand that pharmacies cannot continue like this. I'm so very thankful, and we all are, for the work being done by Representatives Klunk and Matzey in the House to help us pass House Bill 2270. As someone who owns pharmacies in Ohio and Pennsylvania, I must tell you the difference is dramatic. The desert is starting to disappear in Ohio because of this PBM reform. This can be done in Pennsylvania and needs to be done in Pennsylvania for the sake of our pharmacies so that we can continue to take care of the patients that so dearly need us.
I'm one of the statistics. I closed my pharmacy in 2025. In 2018, I opened Vine Pharmacy in Benton, Pennsylvania, which is located in rural Columbia County. Consists of mostly farmland and small boroughs. There had not been a pharmacy in this community for about a decade. About 2 years into the business, I started looking at the financials and the amount of money that was billed and accepted by third-party plans. Comparing this to the amount that we received, there was about a six-figure difference every year. My office manager tried her best to contact the various PBMs for detailed information on the discrepancies. This was a lost cause. No PBM was willing to give transparent, itemized statements, and many did not even respond. In the last quarters of 2024, I realized that Vine was no longer sustainable because of the reimbursements that were continuing to shrink and our extra services were not enough to balance it out. Our pharmacy closed in April of 2025. As a result, there are patients across parts of 3 counties now that have to travel 30 minutes or greater to the next closest pharmacy. Every time I see a former patient, they share how sad they are for our pharmacy having to close. And I tell them, so am I. Yes, so am I.
And thanks to all of you in your white coats for joining us today to fight for this noble cause of serving local communities across Pennsylvania. The PPA and our Pharmacy Coalition will continue to work hard for the passage of House Bill 2270 and its companion bill in the Senate. This legislation will create transparency, consistency, and fairness. Access to community pharmacy care is at a risk. We are in a crisis. Please contact your legislators today. Ask them to support House Bill 2270, Senate Bill 1186. We must protect patient access to pharmacy care. Thank you.